Hi, everyone, and welcome to today's Smith in the World panel on health professions. I'm Jess Pfeffer. I use they, them pronouns, and I'm the Assistant Director of Science and Health Professions Advising here at the Lazarus Center for Career Development at Smith College. I'm excited to host the second panel out of 6 for our 2026 Smith in the World Conference Series. Our next sessions will include presentations on business, finance, consulting, and entrepreneurship, government law and public policy, arts, media, and communications, and science, technology, engineering, and math. We welcome everyone joining us today, including students, prospective Smithies, faculty, staff, family, friends, supervisors, colleagues, alums, and even some past presenters. Thank you for joining us today to hear from these outstanding folks. This is the 21st annual Smith in the World Conference, which is a celebration of students' off-campus experiential learning, including internships, community service, research, or study abroad. In our presentations, students will reflect on how these experiences have impacted and enriched their academic and professional paths. Smith in the World is part of the college's Spring Showcase. You can learn more on the Smith website, and Emily will pop that into the chat. Our panelists today are going to give short presentations about their off-campus learning experiences, focusing on their projects, the impact these experiences have had, and how Smith helped prepare them. Today's topic, as I mentioned, is health professions, and I am honored to introduce our panelists, and I'll introduce them in the order in which they'll be presenting. So first we'll have Miranda Oakes, class of 26, then Sonya Abdalla, also class of 26, then Sophie Burkhardt, class of 27, and Cleo Waxman-Lee, class of 27, and Winta Kebede, who is a 27J grad. Today's session, as you all know, is being recorded, so we ask that audience members please keep yourselves muted so that we can fully hear our presentations. You can submit your questions via chat at any time, though we'll hold questions until the very end after everyone has presented. So feel free to pop them in as we're going, and we'll circle back to that. And on that note, I am going to start our screen share so we can get right into this. And Miranda, I will hand it right over to you.
All right. Hi, everyone. My name is Miranda Oakes. I'm a senior at Smith College, and today we'll be talking about my rehabilitation medicine internship with USA Volleyball. Next slide. So, a little bit about me. I'm from San Francisco, California. I'm a neuroscience major and chemistry minor. I've played for Smith Volleyball for the past 4 years, and I have done research in molecular neuroscience and inorganic chemistry. And I shadowed inpatient physical therapy 2 summers ago at Kaiser Permanente, and I discovered the wonderful world of rehabilitation medicine. However, I'd only really seen the inpatient side, and so I was curious to learn more about the inpatient and outpatient um, spots. So yeah, next slide. My learning goals for the summer was to learn about prospective rehabilitation careers. I wanted to learn about qualities that foster a successful team, both an athletic team with my volleyball side, but also a professional team too. I wanted to learn about multidisciplinary treatment plans that are adaptive based on the patient's needs, and also just generally strengthen my communication skills with patients and medical practitioners. Next slide. So, what is rehabilitation medicine? PM&R, or physical medicine and rehabilitation, is a holistic specialty that focuses on improving function and quality of life. They treat a variety of conditions, and there are a bunch of subspecialties. And the ones that interested me the most are brain injury, uh, spinal cord injuries, and the sports medicine side. And so they do a lot of procedures too. They can diagnose and treat a bunch of musculoskeletal disorders. And I was wanted to combine my love for rehabilitation medicine with also my passion for volleyball. And that's what led me to the USA Volleyball athletic performance team. USA Volleyball is the national governing organization for all types of volleyball in the United States. I worked specifically with the national sitting volleyball team located in Edmond, Oklahoma. In 1976, it was introduced into the Paralympic Games, and then in 2004, the women's side of sitting volleyball was introduced. USA Volleyball strives to promote competition, accessibility, and diversity on an international scale, And this is a picture of the women's national team that have won 3 consecutive gold medals at the previous Olympics. My supervisor was Bobby Moore, who's a doctor of physical therapy for USA Volleyball. He's also worked with the Oklahoma City Thunder, who won the NBA during my time there, which was super exciting. And he also runs his own practice at Side Out Physical Therapy, where he's also a strength coach. A quote that stuck out to me during my time with him is that strength and conditioning leads to resilience. As someone that plays a collegiate sport, I had to lift a lot for volleyball, and I always thought it was just to build muscle, but it actually leads to longevity and helps protect you not only in your sport, but later on through life. So I thought that was really fascinating. Next slide. A day in the life, I would work with their strength and conditioning program, and I would count reps, and I would help spot and encourage proper techniques. And during the national training camps, I would aid with nutrition and also help with equipment. And after the practice sessions, I would observe recovery sessions after practice, and I got to learn a lot about prosthetics and wound care and a lot of other nitty-gritty techniques that are super awesome and help prepare the athletes for success the next day. I also worked with Side Out Physical Therapy, Bobby's private practice, and Bethany Children's Health Center too, with some PM&R physicians. But for the sake of time, I'm not going to go into that. But if you have questions at the end, I'd be happy to talk more about that. I got to use a bunch of fun, nerdy tools too, in Bobby's words. And also, for the sake of time, I'm going to skip this slide, but I am happy to talk about these too. Uh, oh, and so yeah, I had a project during my time this summer, and I drafted 3 rehabilitation plans for 3 different volleyball-related injuries that either I observed this summer or I've known athletes in the past that have had these procedures. I did a rehabilitation plan for an arthroscopic capsulorrhaphy for slap tear in the shoulder, ACL tear and the patella tendon graft, and posterior tibial tendinosis. A fun fact I learned about the ACL tear is that the patella tendon graft is actually the best graft for women because women have more hyperextension than men, and so this helps uh, is actually like the suggested ACL graft for those injuries, and I embedded hyperlinks within my rehabilitation plans to make it easy to see videos and also links to scientific journals. Next slide. Some key moments was fostering relationships with not only the Paralympians, but also the local volleyball team and all the athletes I got to work with this summer. Was able to build rapport early on and develop my voice as a leader. And so I got to work very closely and one-on-one sometimes with these athletes. And during one of my days there, there was the Oklahoma City Thunder Parade. And so I got to go down, and it was so amazing to see everyone downtown. And yeah, I loved working with every single person. They were so kind, and I learned so much about rehabilitation medicine. Next slide. Oh, so my takeaways. I'm not sure why that
Let's see if I can
transition looks
fix
that
that.
way, but
I can
no
see
worries.
if I can. That might be because it embedded over it. Sorry.
Okay, no worries. I can just talk about it right now and we can just
Okay,
move on
cool.
to the next slide. So my main takeaways or the things I learned was how to collaborate between medical professionals. I learned how to be adaptable on the spot and also a patient-first approach. And lastly, I got to develop my own coaching voice and how to be a leader in my own way. And that picture was my final takeaway was that tornadoes usually go around Edmond, Oklahoma. Again, I lived in Oklahoma, and the second day I got there, there was a tornado. And as a Californian, I freaked out, but I learned that it was all going to be okay. And so for preparedness, Smith prepared me very well for this internship. I had a strong background reading and analyzing scientific journals. My stats classes provided me with insight into analyzing the data from these nerdy tools to assess recovery. The neuroscience department taught me a lot about traumatic brain injuries and spinal cord injuries that I got to use with Bethany Children's Health Center. And then I also learned a lot about the imaging and kind of circuitry that I talked about with Bobby throughout my rehabilitation plans. And lastly, Smith Volleyball, although not technically academic, taught me a lot about teamwork and adaptability and provided me with a lot of knowledge in terms of approaching strength and conditioning and rehabilitation from a volleyball perspective. Next slide. And then my future, I confirmed my interest in rehabilitation medicine, and I'm taking 2 gap years to apply to medical school. I'd like to learn a little bit more about the politics of healthcare because I was able to kind of gauge a little bit of that working both inpatient and outpatient. And I hope to stay connected with USA Volleyball, and I'm excited to see where the world takes me after graduation. Thank you. And I want to give a big thanks to Bobby Moore and the USA Volleyball team, along with Greg Walker and the Praxis Grant and the generous Smith alums that helped make this program possible. Thank you.
Oh, thank you so much, Miranda. And I'm sorry about that slide mess up on my end.
All as well.
We're going to move right into Sonia's presentation. Sonya, you ready?
Yes.
All right. Here you are.
Hi, I'm Sonya. I'm a neuroscience and psychology double major on a pre-health, pre-med track. I'm going to be talking about my summer internship at Boston Medical Center as a psychiatry intern. So I just want to begin with during this internship, I was able to gain hands-on clinical exposure, that was my main goal out of this internship, but also learn more about mental health care and understanding how psychiatry works in practice. This experience was especially meaningful to me because I've had worked in a such a similar setting, but this time I combined it with a clinical work and research and work, especially with patients who had recovered from psychosis. Next slide. So my day-to-day was a mix of high-level clinical observation and direct community support. I will go more into detail about what direct community support means, but one of my main role was a shadowing of a chief of psychiatry and other psychiatrists, also inpatient and outpatient, seeing and observing how they interviewed patients, and I've been in a group-based setting, therapy sessions, and treatment planning meetings. I also gained exposure of several of anti-drug medications and how treatment decisions were made in a real clinical setting, which was really cool. And I learned a lot from that. I also supported education and employment team within the psychiatry department, RAP program, Recovery After Psychosis, which there I got to help patients after psychosis with their resumes, job application, and ongoing check-in. And this showed me how psychiatry care goes beyond medication and therapy and includes helping patients rebuild stability and independence in their daily life. Also, I got an opportunity to co-author an abstract posters focused on socioeconomic factors influence engagement in the care for psychosis patients, which was really cool. And I could see it helped me to connect the clinical observation with the research and policy level questions. Next slide. Before and during the internship, I completed several trainings. As we all know, for other internship and job, this has to be done. But these training sessions helped me to understand patient confidentiality, ethical research practices, and also how to navigate a clinical system responsibly, especially in a hospital, such a big hospital and a really sensitive department. Next slide. Also, there are several situations that have happened to me during the internship, and there are so many patients that I would see them over time during my internship. It's either inpatient or outpatient, but one of the most impactful part of this internship was seeing how social or economy and culture factors the shape of psychiatry care. Working in a safety net hospital like Boston Medical Center, I observed how barriers like housing instability and even language differences within the patient and how we had interpreter within the sessions of the psychiatry interview and how to communicate or navigate that. I learned how important trust and consistency is around patient-centered communication are, especially when we're working with individuals who are actively experiencing psychosis. So these experiences really enforce me that psychiatry is not just about diagnosis or symptoms or just give them the medication and then go, but mostly about understanding the full context of the patient's life. Smith prepared me really, really well before going into this internship through my neuroscience and psychology classes. Mostly one of my neuroscience classes, clinical neuroscience, prepared me really well on understanding how the brain works and how, and mostly in the other psychology classes, learning how everything's effect on the behavioral of the patient. So I would kind of knew more. Um, because of my psychology and neuroscience combined together, and also because of my pre-health requirement labs, knowing how the medication works, because during the every sessions being observed with a psychiatrist or working in a hospital for 8 hours, I would have to know why we give this drug to the patient and what this drug's effects on the brain or on the behavior of the patient. And I got chance to actually talk to patient and interact with them and have the basic question in the beginning before my supervisor would start. And I've gotten all of this experience throughout my not just my neuroscience and psychology class, but also sociology, how being able to talk to a patient and in what level, and also from the trainings that I've gotten from the hospital. Also, I had a previous personal experience working for UNHCR, United Nations High Commissioner for Refugees, as an interpreter. So I have been in this setting before, but it strongly shaped how I approach the patients and the teams and working in a setting like that, which we had patients that they're actively in a psychosis stage. It helped me to communicate with empathy and being really culturally aware. And also the cool thing is like some patient would come in and they would speak in different languages because I was an interpreter in UNHCR. So it would bring me back to my days that I worked at UNHCR, which was really awesome to me that sitting there this time I'm not the interpreter and there's someone else interpreting for the patient and to the chief of psychiatry that I'm shadowing. It's such a cool experience to get like looking at the interpreter and trying to help the patient, even though there's a language barrier and there's a culture barrier in here, and seeing how the chief of a psychiatry approached different culture and how understanding is from his perspective to other people and how he believes in giving treatments and the way that he started asking his questions. Because during my time at UNHCR, it was really hard to understand how we treat the patient that they're from different cultures. So it was really interesting and really awesome to see how the psychiatry department handles different culture and language and how aware they are. And Smith have helped me being in such a diverse college and taking all of those classes have helped me to be way more aware than I was when I worked for UNHCR. Next slide. So this is the most interesting part of my internship, I guess, because all of my friends and my family start asking about how did I landed this internship. It was not, trust me, through a big portal like LinkedIn and like apply for this job. I'm not saying LinkedIn is bad. I'm just saying that it was not me going on a portal or a forum posting something that there's an internship here. I have been following the chief's psychiatry of Boston Medical Center's work, and I've read all of his paper and some of them for Smith College classes, my neuroscience and psychology classes mostly. And I learned his work, and I know he have worked for over 25 years internationally, and mostly worked with underserved population, which was my interest. I reached out personally, and I had to, this is really funny, but I'm gonna still say it. I had to generate his email through AI. And I had to reach out myself and be like, I'm really interested in your work and I love everything I've seen. I've read all of your papers. Can we please meet? Can I just talk to you? And throughout of that, just like being initiative, that would be kind of my advice for Smithies out there to build connection and just don't be afraid. So I just shared my academic interests and I made this internship possible, having gaining more clinical exposure in a hospital. I've worked in an emergency department, in an outpatients, and also being able to be in a research and co-authoring an abstract and doing literature review for their program. And I'm really grateful for Smith, the Smith Fund, and I don't think this would have been possible without the Praxis Fund, which allowed me fully focus on the internship without needing anywhere else to work. And I did this internship and paid, and I was really happy being able to help other underserved population and gain more experience. Next slide. My main takeaway from this experience are I gained really meaningful clinical exposure and academic like psychiatry in a psychiatry hospital, and also understanding psychosis care and antipsychotic treatments. There are so many of them that I learned like more than 37 names of the pills and how do you use them and which one for what symptoms. But also it confirms my interest in a psychiatry and working underserved population and how much it brought me back to the days that I was an interpreter and I've worked for refugee. And I was being in the same similar setting, so I understood how much as much clinical is important for me and how much is important like being in a like helping a vulnerable population like that. So this internship helped clarity my future goal and showed me that it's a clinical and research and advocacy can somehow intersect. Um, Next slide. So thank you so much for listening. I really appreciate the opportunity to share my experience. I would be happy to answer any questions at the end. Thank you.
Thank you so much, Sonya. That was fantastic. All right, Sophie, you are up. So I'll pull up your first slide, and here we go.
Okay, hi everybody. I'm Sophie Burkhardt. I'm a Spanish major and a chemistry minor in the class of 2027 at Smith, and I'm going to talk about my experience with the art of dentistry. So, ever since I was young, I've enjoyed the sciences, but I often found myself drawn to the arts. I taught myself how to play the guitar. I also have a passion for beading, and I consider speaking other languages to be an art. Being able to communicate with those around you and understand what they're saying without translation is a very special thing. I grew up speaking French at home and learned Mandarin throughout middle and high school, but later decided to start learning Spanish. In ninth grade, I went to work with my great aunt, an endodontist, for a day. Watching her interact with patients and really meet them where they are at with the same empathy and compassion that she treated me and the rest of her family with was inspiring. I realized dentistry was a place where I could use my empathy and combine science and art. So after this, I started to work at my pediatric dentist's office as an office assistant. I couldn't do much at that age, so I mainly filed receipts, mailed out birthday cards to patients, and made the goodie bags you get at the end of your dental visit. Although this was not exactly what I had envisioned myself doing, it allowed me to experience what running a practice was like and furthered my understanding of the importance of being personable, compassionate, and empathetic in this field. When I got to Smith years later, I was relatively confident I wanted to be a dentist, but I was still not fully sure. So I started the Smithies and Science Club to help students be exposed to different fields that they might not know about, and network with professionals in those fields. We've had an optical engineer, a behavioral ecologist, and a rheumatoid arthritis specialist come and talk about their careers, just to name a few. And during this time, I realized I loved the chemistry classes I was taking, and ironically enough, I did really enjoy organic chemistry. But through the liberal arts curriculum at Smith, I was also taking Spanish classes and fell in love with the program we have, and further in love with the language itself. So I declared a Spanish major and a chemistry minor, which I was able to do thanks to Smith and the liberal arts curriculum, even though I am pre-dental. Also, in my freshman year, I started to work in Kate Queenie's lab, focusing on tunable wettability, which was very interesting and a great way to apply my love of chemistry, but showed me that full-time research was not exactly what I wanted to do. I missed interacting with people and having an immediate effect on someone's health, both qualities which dentistry entailed. So I went home over winter break my sophomore year, and when I went to the dentist to get my checkup done, I asked if I could shadow him that coming summer. At the beginning of the summer, I went to take an infection control course and a CPR course, and then I jumped right in. So, next slide, please. I started in the front office, learning about the process and organization of the office. I set up rooms, brought patients back to the room, and got the patients ready for the dental assistant to come in. I learned to hide the injections, which you can see in the photo right there that's under the paper towel, to reduce stress in patients, and that an organized tray was extremely important to a procedure going smoothly. At the same time, I was able to shadow most of the appointments, watching behind Dr. Chow as he worked. I saw crowns, bridges, implants, cleanings, dentures, root canals, fillings, anything you can imagine. And I saw the precision and care that Dr. Chow put into each tooth and remembering he has over 4,000 patients and he remembered all their names and stories, which I think was extremely impressive. And I was slowly starting to realize that dentistry itself was an art. Next slide, please. The patient in this photo is my neighbor who happens to also be a patient at Dr. Chow's office, and this was me working on her well, it was a staged photo to be honest with you guys, but I was working on her um, with him and helping assist, which I was able to do later on in the internship after shadowing a lot and understanding what was going on. The tooth that's on the left was from an extraction. It was causing an infection in the patient, so it had to be removed. I just want to mention I'm going to briefly talk about blood. In a complex procedure like an extraction, there are three sections used due to the amount of blood. One remains in the mouth of the patient at all time. One is held near the tooth and is moved to the back of the throat as needed to remove saliva and blood. And another is a very precise section, um, which as I began to assist more, I was able to use and aid him with that in one procedure. This section has to be frequently rinsed with water and is so small it can remove the blood immediately while the dentist is using the pliers to wiggle the tooth free of the gum or sew up the gum after the tooth has been, or stitch up the gum after the tooth has been removed. Although I experienced a lot throughout my time at the dental office, the two visits I remember the most were when a patient asked Dr. Chow for veneers and a gold crown. Dr. Chow said no. At first, I was shocked. Often in jobs like these, especially something as cosmetic as dentistry, you say yes to your patients. Dr. Chow went on to explain to him that like veneers were a waste of money, frankly, for how long they last. And a 20-year-old patient with healthy teeth should not shave them down to do veneers that will come with costly upkeep and damage, possibly damage oral health, more than it'll help. He suggested whitening, tooth whitening, and orthodontia instead. As for the gold tooth, he explained that in 2 years, when the urge to have a singular gold tooth for a trend is gone and the patient has spent a lot of money on it, he won't be as happy as he thinks he will be in that moment. So he had the opportunity to make a lot of money off of people who were willing to do whatever for trends and cosmetic stuff. But instead, he found ways to get similar results for the patients that were cheaper and more beneficial to their oral health. Another patient interaction that stuck with me was when a man who spoke only Spanish came in at the end of the day to receive care. He came in with his wife, who was going to help translate for him, and he was visibly anxious. He had to get one of his front teeth removed because of a serious infection in the gum that the tooth was causing. And Dr. Chow let me stay in the room in shadow for this procedure. For a few minutes, the wife had to leave to go talk to the front desk about payment and after care for the procedure. But Dr. Chow continued to talk to the patient. However, because the patient needed someone to translate for him, he was unable to understand. Um, I stepped in and was able to translate for him using the Spanish I had learned at Smith to explain what was going to happen during the procedure to calm the patient. It was extremely rewarding to use one of the languages I had learned to help people, which is something I plan to do in my future practice too. So, although I learned a lot of skills that will be extremely beneficial to me in dental school and how to correctly run a business, the main thing I learned from Dr. Chow was how important it is to really care for the patient and how important empathy is. I argue that dentistry is an art beyond just what you're creating when you're physically working on the tooth. Creating a connection with the patient through um, communication, holistic consideration of the patient, and empathy is the real art in this field. This internship reaffirmed what I was doing at Smith, especially majoring in Spanish. When I come back to Smith in the spring, geez, I was going to say fall, in the spring, I'll continue to take pre-health STEM classes. This semester, I'm taking biochemistry and microbiology, and further take Spanish classes. I'm also an HCA, so I'll be able to continue to do interpersonal work, although it looks a little different than dentistry. Yeah, thank you.
Thank you so much, Sophie. All right.
Hi.
Cleo, you're ready. Here you go.
Hi, my name's Cleo. I'm a junior biology major at Smith and I am pre-vet. So this summer, I worked as a veterinary assistant at animal wellness centers in Los Angeles, California. So Animal Wellness Center is a small animal general practice. It's privately owned by Dr. Annie Harvelix. And this summer, I mostly saw dogs, cats, bunnies, and birds at the practice. So Animal Wellness Centers also has a foundation that's attached to them, and through this foundation, they raise a lot of money for rescue work that they do with their rescue network, and they also do a lot of disaster response efforts. It's been 1 year since the Palisades fire, and throughout this year, Dr. Annie and Animal Wellness Foundation has worked really hard to take care of some of these animals who've come from families that have experienced the effects of the fires. And during my time at the hospital, I was able to work with a rescue organization and I was able to walk dogs, feed dogs. They have another location across the street from the hospital where they house a lot of these dogs. So that was a really cool experience. So kind of in a day-to-day, I would go into the hospital and I would do patient history. So I would meet the patients in the lobby, take them into a room, get basic history for the doctor. And then I did a lot of handling of the animals and basic treatment, which included administering vaccines, taking urine samples, fecal samples, taking weights, heart rates, and then running different kinds of diagnostics, filling medications, which were then approved by doctors. And then I also got to shadow a couple of surgeries. And I did some cleaning of cages, exam rooms, and I also was able to work at the front desk for some of the time that I was at the hospital. So some highlights. I had a very large variety of different cases that I was able to observe. So that could be anywhere from I got to see some acupuncture done on a corgi, and then another day I was able to observe some oncology cases. I got to help with x-rays. I got to run different diagnostics. And this photo is of a kitten named Blue, and he was put in the nebulizer to treat his upper respiratory infection. So I really saw a ton of different kinds of cases, which was really cool because I think going into this internship, I expected a little bit more of just like some general, like I got to see some dentistry and some basic treatment, but I also got to see a lot of complex cases, which was really beneficial and really cool to see. Good and bad days, there were some days that were really hard and some days that were really easy. And I think this was a great experience for me to see kind of the highs and lows of working in veterinary medicine. And this was my first clinical experience that was hands-on. I had done previously a shadowing experience, but this was my first experience kind of hands-on working full-time in a hospital. So I really got to see the highs and lows of veterinary medicine. And at the end of the day, telling myself that this was still something I really wanted to do. And mentorship, I worked closely with Dr. Pernilla Edstrom, and she's the chief medical director at the hospital. So it was really amazing to talk to her about her journey to becoming a vet, and just to get advice and support from her throughout my internship. And then in terms of professional connections and friendships, I was able to work with a lot of current veterinary students, including a student at UC Davis. So it was really cool to speak with students who are kind of going along the same path that I hope to take, and to make friendships with the other veterinary assistants and technicians who worked at the hospital. So in terms of skills that I strengthened, I think strengthening my communication was one of the biggest things I did over the summer. I think communication is very, very important within medicine in general, and especially within veterinary medicine, because your patients can't talk to you. So it's really important that you're getting specific details from owners and understanding the issues that they're having with their animals, so that I was able to then relay these to the doctor and make appointments more smooth. And in terms of teamwork, working with on a day-to-day basis, I'd be working with around 3 other veterinary assistants. So making sure that I'm asking for help when I need it, or taking the initiative and taking a patient back, or helping someone if they, didn't ask, but I saw they're struggling. So working in a team was really crucial to my success at the hospital. And then taking leadership in certain moments, thinking critically. Working at the hospital was a very fast-paced and at times stressful environment. But when an animal comes in who needs like emergency treatment, for example, that was something that happened this summer. We had a dog come in that had stopped breathing. So in that moment, I was feeling scared, but I had to think critically and kind of just go into it and help with taking care of this animal. I had to be very adaptable. There's a lot of changes happening day to day. There were some days where we were very understaffed, and we just had to work with that situation. And I think I gained a lot of resilience. As I mentioned earlier, this was a very stressful experience at times, but I think I learned to manage that stress really well, which will be very helpful for my future career. So setting yourself up for success. All of my Smith courses prepared me very well for this internship. I have taken chemistry course at Smith, and my organic chemistry background really helped me understand the different medications that I was giving or that I was helping to fill for some of my patients, and understanding how that was going to affect their bodies. Stats was also helpful. I was reading some research papers to get a deeper understanding of different cases that I was helping with. And so my ability to analyze research papers and look at statistical data was skills that I learned in my SAS class at Smith. And then also my biology classes, my genetics classes were really helpful this summer in understanding some cases. And in terms of on-campus animal experience, I have been able to work in a neuroscience lab on campus, the Harrington lab. And so that's been really cool because I've been able to work in the animal care facility. So I've had some hands-on experience with lab animals, which is really unique. And I think something that is hard to find at any school, regardless of if they have like a pre-veterinary major. So that's been really cool at Smith because I have been able to find animal and veterinary medicine related research opportunities. And then the Smith Alum Network, my first experience in veterinary medicine was doing an externship at Integrity, which is a specialty practice that's about a 30-minute walk from campus, and it's run by Dr. Maloney Huss, who is a Smith alum. So I was able to get this experience because I go to Smith, and I reached out and I told her that I was a pre-vet biology major, and that's kind of how I facilitated that experience. And then conferences, I recently went to the New York Vet Show, which was a really cool experience to meet other veterinary professionals. I got to meet a bunch of different doctors who worked in a lot of different fields across veterinary medicine who were kind of from the East Coast. So that was a really good networking experience for me. And then in terms of how I landed this internship, some of you might be wondering how I actually got this internship, which is kind of the most important part of landing an internship is how do you get that internship? And I actually have taken my pets to animal wellness centers, so I had that kind of patient connection to the hospital. But it also helps to just email. Like it sounds easy, but I did a lot of research on different small animal practices in Los Angeles, and I just sent a lot of emails to different practice owners. And you really have to kind of just put yourself out there and take that initiative. And then yeah, that's kind of how I landed this internship. Yeah, so that was my internship this summer. Then I have some kind of, these are funny memes, but it's kind of interesting. There were a lot of times when owners would come to the hospital and they wouldn't have their cat in a carrier or their dog wouldn't be on a leash. So this kind of ties back into the whole communication aspect of my internship and working with people from different backgrounds to understand how to safely be in the hospital environment. So yeah.
Awesome. Thank you so much. Thank you to all our presenters. And we have one more presentation. I'm going to reshare my screen in 1 second because it's a video presentation that was sent to me in advance. So give me 1 sec and here we go.
Hello everyone, my name is Winta and I'm going to be talking about my summer internship in Kenya. I'll start by talking a little bit about myself. I'm a cognitive neuroscience major on the pre-med track, and I'm expected to graduate in 2027 J-term. During summer, I was able to complete a public health internship in Kisumu County, Kenya, where I was able to gain a clinical observation experience and participate in a community health work. This internship gave me an exposure to healthcare delivery in a different and new setting. I'll talk a little bit about where I was located. I was in Kisumu County, which is one of the 47 counties found in Kenya. Kisumu County is found in the western region of Kenya along Lake Victoria. I was spending most of my time in Kisumu City, which is the county capital, and I was working in 2 hospitals, Jaramogi Oginga Odinga Teaching and Referral Hospital, which is the level 6 referral hospital, and Kisumu County Referral Hospital, which is a level 4 referral hospital. After my rotations in the hospital, I was able to join a free medical camp. The free medical camp was a totally different environment than to the structured clinical environment of the hospital. Free medical camps are a temporary outreach programs that offer healthcare directly to the communities. They're usually organized by hospitals, NGOs, or community leaders, and they are usually held in underserved or rural areas to provide basic services in areas where people don't have access to hospitals or clinics. So what was my role in the camp? So mostly I was observing different consultations, either in the eye treatment or the general consultations. And I was also able to observe some of the cataract surgeries. I got a chance to do some of the cancer screening. I was recording patient flow and the conditions seen. I was able to interview some of the patients and the volunteers, and I was helping with some of the vital signs. So to understand what the impact of the free camp was, I was able to ask some of the patients and the volunteers why they chose to come to the camp. So one of the major reasons people chose to come to the camp was financial barrier. One mother even said like she came borrowing 50 bob for transportation and she will have to borrow another 50 bob to go back home. And she told me she doesn't want to spend any money going to the hospital. The second one is unavailable medications and their local dispensaries or hospital facilities. So an elderly woman shared that they have been to the hospital, they have been to their local dispensary, but whenever they're done with their treatment, they usually are told like their medication is out of stock and they have to buy it from a private chemist. And this concern was reinforced by a pharmacy manager at the camp who said, here I can actually give my community the medicine they need. I don't have to send them empty-handed. And a third reason was so most of the services that was given here were not given in their nearby or local clinics. So most of them said like they don't have dental access or eye care treatment or physio care in their local treatment, in the local clinics. The fourth one is food insecurity. Most of them said like they came because lunch were offered. And one patient said it's better to come here because food is provided. And the other challenge was a health insurance challenge. Many have founded the annual SHA, which is the new universal health coverage that's being implemented. That payment was very unaffordable. One mother explained that she only paid for 3 months of her annual coverage when she was about to give birth. So most of them are paying the required payment as a reactive measure when they need the treatment rather than having a consistent coverage. So how Smith prepared me, most of my science courses has strengthened my ability to communicate complex ideas clearly and effectively with the doctors I was working with. And Smith's supportive environment encouraged leadership and self-advocacy, which was helping me to ask what I needed, what I wanted to learn, which departments I wanted to go to, and it helped me navigate new challenges. And the IDP Design Your Path pre-health course, which I took during last spring, introduced me to different healthcare roles, which helped me better appreciate the interdisciplinary care once I was inside the hospital. And I was able to use most of my neuroscience coursework directly when I was doing my neurosurgery rotation. It helped me understand the basic clinical concepts and procedures. So how does this internship relates to my future goal? So my long-term goal is clinical practice in global and underserved settings. I'm interested in organizations such as Doctors Without Borders. And this free medical camp gave me what that would look like. And this internship provided me with new clinical environments outside of the structured clinical setting. It showed me the interdisciplinary and the team-based care system. And I was able to see the adaptation of medical practices to a limited infrastructure. I would like to acknowledge everyone that's right here. And I want to give a special shout out to Smith Lather Center for providing me with Praxis funding, which I wouldn't be able to do if I didn't get the funding for the internship. Thank you, everyone.
I'm muted. Hi, everyone. Thank you so much for all these fantastic presentations. I'm about to check the chat. So if you've had questions that you've been sitting on, let me know. Let's see. All right. I'll start with one, unless no one's raised their hand yet. Okay, great. What kind of questions did your experience bring up for you? Did you discover new problems you want to explore more in the future, either through coursework or work outside of Smith? Who wants to jump in first to try to answer that? Yeah, Miranda.
I can go a little bit into that. So as I mentioned, my supervisor, Bobby Moore, he ran his own like private physical therapy practice. And I kind of mentioned that I wanted to learn more about the politics of healthcare because at the end of the day, healthcare is a business. And Bobby's like patient first approach was something that was kind of unique because at my inpatient shadowing opportunities, the physical therapist had to hit a specific quota or like a certain amount of patients like every day in order to kind of keep their job. And with Bobby's private practice, he was able to kind of instead of like trying to book as many appointments as possible for like in order to hit like a certain quota. His goal was to focus on getting patients um, back to like their to gain as much function as they could on their way back to recovery as fast as possible. And so I thought that was truly amazing and unique. And also, I didn't get to talk about my um, time at Bethany Children's Health Center, but it was a faith-based hospital, and so they got a lot of their funding through donations. And so through those donations, they were able to provide a lot of care towards a lot more patients that weren't covered by insurance. And so they were able to take care of a lot of patients that were undocumented or other patients that might have had like a harder time seeing it through more private healthcare facilities. And so again, before as I'm kind of exiting Smith and I want to learn more kind of into the politics of healthcare and how these businesses do run, because I think in order to provide the best care for patients moving forward, I'd like to be informed in what ways I can truly put the patient first.
Awesome. So it sounds like you got like a lot of kind of context for the different sort of social issues that might be really impactful for you to think about as you move into your career. Yeah. Sonya, Sophie, or Cleo, anything you want to add about sort of something that like kind of influenced the direction that you might go in or kind of change your course or like impacted the you coming back to Smith afterwards?
I think I
Yeah,
can
Sonya.
go. Yeah. I had the idea of going into this internship. I want more clinical hours. I want to gain more exposure into a clinical hour. I want to be in the emergency room because that's like what it requires. Most of like the PA and medical schools and the health profession. But once I get there, I got exposed to their RAP program, Wellness Recovery After Psychosis, and they worked a lot with like their ability of patients to get back on their feet and go out there and get a job or go back to a college, go register in high school. And I it changed my perspective. And once I came back to Smith, I tried to look more into like a public health area. How could I advocate for refugee? And how like I got back to my old job that I was like I was doing it at UN and getting more out there and be like, I really want to like broaden my search of like what I want to do right after Smith and taking courses more of a like policy making and like refugee and policy. So it was a really great experience for me to not only and not be closed-minded when you are going into a job and having a more like open-minded of like doing other jobs. I know it's like a paid internship, so you kind of do like from here and there a little bit of this, and like you're in the office, you might be assisting someone else, you might be doing something else. I had the idea of like, no, I just want to do a clinical hour, like get my clinical hour in. But once I get there, I was like, oh, I'm totally open to do research, to do more literature review and get, and out of that I got like published a paper, or out of that I got to help patients that they reach out through LinkedIn to me and they're like, oh, I got into the college that we applied together. I got this job because you were helping me. It sometimes might sounds boring, like sitting in an office and actually doing a lot of resumes and like reaching out to colleges, but then the outcome is really make me really happy. And I was like, this is something when I go back to Smith or like after my graduation, I could look more into it.
Awesome. Right. So it sounds like going in being like, I really want to gain this experience, but staying flexible for what the experience actually offers will really
Exactly.
broaden the things you get and take away from it.
Exactly.
Yeah. Cleo, it looked like you were about to say something before.
Yeah, I was going to mention that this experience made me more interested in working with more rescue organizations. I didn't talk about it a whole lot, but I was able to work a lot with the rescue organization that's part of the hospital that I worked with. And we also served a lot of low-income families at the hospital and a lot of Spanish-speaking families. And I took a Spanish class at Smith and I took Spanish in high school. So I kind of had a foundation of Spanish, but I'm interested in learning more like Spanish medical terminology. And then at Smith, um, I'm interested in taking more chemistry courses and kind of learning a little bit more about pharmaceuticals, and kind of applying that to my work in the neuroscience lab that I work with and working with the 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 mice in the lab and kind of medications and painkillers and things like that. And also, a lot of the families at the hospital took advantage of spay and neuter clinics and free vaccine clinics. And I would be really interested in maybe next summer working with some of those, finding, a mobile clinic and doing some of that work because I found it to be very meaningful and I really enjoyed finding ways to be creative with certain families who didn't have as much of a financial means to do expensive treatments for their animals, and working with the doctor and kind of finding ways to optimize that treatment for people who didn't have as many resources to take care of their animal. So that was really meaningful for me, and I'm hoping to work with more community resources like that in the future.
Awesome. It's so cool how the internship both like refined your interests and broadened your interests at the same time, where you're like, I want to pursue like this kind of aspect of this a little bit more and take some more courses to learn more about these other things. Yeah. Sophie, is there anything you want to add about sort of how this internship kind of surprised you or like showed you something slightly different than maybe what you expected?
Yeah, I had originally wanted to go in specializing, and I'm still kind of unsure, but being able to see like how much as a general dentist, Dr. Chow, the dentist I worked with, was able to do, really, I don't know, it kind of redirected me a bit in the sense that like if I own my own practice, I can be my own boss and decide what I want to do, you know. And that also ties back to what Miranda was saying. You don't have to meet quota, you don't have to like see a specific amount of patients. It's more like actually being able to interact and care with like care for the patient and all of that. And also similarly to what Cleo had said and what I had said in my presentation, I used my Spanish this summer when I worked with a dentist. So I think further learning different languages is really important and something I plan to continue to do when I'm back at Smith.
Awesome. Thank you so much. We have time for about one more question, and I'm wondering if each of you kind of represent a slightly different health profession or focus in health professions. And I'm wondering if you could just leave us with some advice for folks who are interested in finding an internship in a health profession. Like, what would you tell them to do? How would you tell them to get started? I know you all kind of dropped some of that in your presentations, but like, what's the like takeaway of like, don't be nervous to blank? Um, Anyone want to guess? Yeah, Sophie, want to get started?
I think this is what everyone's gonna end up saying, but I think you just have to reach out. And there's a bit of like you're gonna get rejected at some point. People are gonna say no. You just have to broaden your scope, apply to as many places as you can, reach out to as many people as you can, because there are people out there who want to see you succeed. And especially the Smith Alumni Network is super, super strong. I actually called with um, someone who used to be a dentist, or who is a dentist who used to go to Smith. And I was able to hear advice from her and everything, and was just able to reach out and talk to her. So you don't know till you try. Just reach out.
All right, Cleo, and then Miranda, and then Sonya.
I think kind of tying into that, my advice would be to reach out to alums. Um, I was talking with Ellie and I was able to get a lot of contacts of Smithies who are now vets in different fields. And that's where I started. I emailed them, I got some phone numbers, and I just started talking to them. And I heard what they had done during their time at Smith. I heard what organizations they had worked with. And I think that's my biggest tip is to reach out to the Smith Alum Network because it's huge and all of them want to help Smithies. So I think that's going to be a really great resource to you if you're looking for internships.
Yeah, I agree with what everyone has said so far. Um, what a piece of advice I would give is to be persistent too in like emailing. So like at first, I mean, I talked to like a couple people about the USA Volleyball internship, and at first I wasn't really here. It was a little bit of radio silence, but I made sure to like I would give it a couple days and then I would send another email. And I mean, I'm sure it was kind of annoying at a certain point, but it worked and I was able to get a response and that's how it worked out. And also, another tip is I would have is like to invest in like the people around you and to like build your network. And so when I was there, I actually didn't intend to like work with the local hospital, but one of the Paralympians that I was able to like build a relationship with, so that his wife worked there, and then his wife put me in charge and kind of like frontlined me to like the top of their shadowing program. And so, yeah, like, I mean, invest in people. You never know where it'll take you. And yeah, the worst thing someone can say is no. So, don't be afraid to try.
Awesome. Thank you. And I just remember also, Miranda, that you used your connections also to like nudge and nudge and be like, oh, actually, I know someone who is there. I'm going to ask them to like say something for me too. Which I remembered you saying once to me. And I'm like, yeah, use those connections. People want to help you. Yeah. Sonya.
I think I would just maybe echo whatever what we have brought up, but mainly I just want to say that don't be afraid when you reach out. You don't have to be perfect. You don't have to know everything. You don't have to be like, I've read everything about you and I know everything about this doctor or I know everything about this patient or the setting that I'm going into. I think the people in the health profession, they're really nice and they want to actually teach students and they love to teach students. So my main way of like getting the chief of psychiatry and get the interview was like, I'm really curious. I have this background, I have this and this, but I'm really curious how this works in the United States because I don't know how people in a different settings and culture and language barrier and everything else. And I would say the same thing as Miranda mentioned earlier. It was like using the connection I got out of like so many recommendation letters for my graduate schools from where I worked, where I did the internship, from so many psychiatrists and even like the nurses that I met, and even any like patients and people that I got to make network with. Yeah.
Thank you. So I just want to say thank you so much to everyone who's here. Thank you to Sophie and Miranda and Cleo and Sonya and Winta for your fantastic presentations. I hope this encourages you all to be bold and brave and just reach out to people and see what happens. Um, and please come to other Smith in the World about the different internships. And thank you everyone for being here. I hope you have a wonderful rest of your night.